The year 2025 marks the second year of implementation of the 9th Cooperation Program between the Government of the Republic of Burundi and the United Nations Population Fund, UNFPA. This strategic collaboration has helped consolidate progress in improving maternal and neonatal health, notably through strengthening the quality of emergency obstetric and neonatal care, thereby saving the lives of many mothers and newborns, while intensifying efforts to combat gender-based violence. Beyond health services, the joint actions undertaken have contributed to improving family well-being by promoting informed choices in family planning, strengthening HIV prevention, and ensuring integrated care for survivors of gender-based violence. Furthermore, 2025 was marked by significant progress in the empowerment of young people and women through the promotion of innovative entrepreneurship initiatives aimed at enhancing their socio-economic inclusion. The use of digital data from the General Census of Population, Housing, Agriculture and Livestock has also laid a solid foundation for more precise national planning in alignment with Burundi's development ambitions outlined in the National Development Plan and the Vision 2040-2060. At the same time, efforts continued to effectively address environmental and climate-related challenges, ensuring that the most vulnerable populations are not left behind. The year 2025 holds a particular symbolic significance, marking the 50th anniversary of UNFPA's presence in Burundi. The celebration of this golden jubilee, graced by the presence of Her Excellency the First Lady of the Republic, as well as technical and financial partners, donors and beneficiaries, was a key moment to recognize the progress achieved over 5 decades of partnership. This commemoration also provided an opportunity to renew the shared commitment to achieving even more ambitious results within the framework of the 9th program cycle. In 2025, our absolute priority remained saving lives. Through coordinated action, we rose to the immense challenge of preventing 860 maternal deaths in 2025 compared to 810 in 2024 across the country. This victory over fatality is supported by more accessible family planning, which helped prevent 270,000 unintended pregnancies in 2025, up from 250,000 in 2024, as well as 50,000 unsafe abortions compared to 46,000 in 2024. Today, the number of new users of modern contraception has increased by 6%, rising from 670,000 in 2024 to 710,000 in 2025. Burundi has thus reached a historic milestone in women's health and autonomy. This success is driven by a radical digital transformation, the rollout of the Medexis ALMIS system in 100% of health facilities. By reducing order lead times from 91 to just 11 days, stock outs have been eliminated, ensuring that every health product is available at the critical moment when lives depend on it. Saving lives also means restoring dignity. At the Urumuri Center in Gitega, 114 women were freed from the ordeal of obstetric fistula. Beyond medical treatment, UNFPA facilitated true social reintegration, where 39 of women who had already benefited from fully social economic reintegration were enabled to reclaim their place as active and respected members of the society. In humanitarian contexts, where needs are most urgent, our response system was strengthened throughout the strategic deployment of midwives and the provision of emergency kits. Because every pregnant woman, even in crisis, has the fundamental right to receive care and give birth in safe and dignified conditions. 10 midwives were deployed in health facilities to improve access to reproductive health services. As a result, 1,068 women received antenatal care and 195 deliveries were assisted by skilled personnel. In addition, 30 reproductive health kits containing essential medicines were provided, enabling 4,017 pregnant women to receive obstetric services and vital sexual and reproductive health information. To continue reaching the most vulnerable, Innovation has been collective. As part of a joint project with the WHO, UNAIDS and UNICEF, the self-care strategy accelerated access to healthcare. Strengthening women's autonomy, this approach saves valuable time by reducing the need for travel, allowing women to focus on daily activities. Moreover, thanks to tools translated into local languages such as Kirundi and Swahili, 2,861 women now manage their health with confidence and efficiency. Finally, we are building the future on international quality standards. In 2025, we harmonize provider practices by updating emergency obstetric and neonatal care protocols and guidelines in line with the WHO new 2025 recommendation. This standardization effort was accompanied by a major strengthening of technical capacity, where 100% of maternity wards in the emergency obstetric and neonatal care network in former provinces of Rutana and Muyinga are now equipped with modern equipment and highly qualified personnel. In 2025, our commitment to gender equality and gender-based violence prevention reached a new level of effectiveness. Nearly 4,000 people received specialized care, while over 1,400 survivors were provided with financial support to rebuild their lives. This protection extends to the most fragile contexts, where more than 100,000 people, including refugees and displaced populations, were reached through prevention efforts. On ground, 120 community focal points now ensure continuous vigilance against sexual exploitation and abuse. Additionally, over 4,000 dignity and menstrual hygiene kits were distributed. To eradicate violence, mindsets must change. Today, 19 reflection groups are actively working within communities to challenge harmful gender norms and stereotypes. To ensure sustainability, UNFPA supported the development of the new National Gender Policy 2026-2040, alongside the establishment of standard operating procedures, ensuring a coordinated and institutionalized response to inequalities. Investment in adolescent and youth human capital reached a record scale in 2025. More than 1.7 million students now have access to vital information on their health and well-being within schools. To sustain this impact, over 1,415 guidance teachers and community members were trained in counseling. Community innovation also stood out through the engagement of these mentors. In 2025, 1,053 of them were trained in producing reusable sanitary pads. Beyond technical skills, they became knowledge relays, directly transmitting these competencies within their schools. This solidarity-based approach helped break a major taboo and significantly reduced school absenteeism among girls, enabling them to continue their education with dignity. Keeping young people in school is only the first step. Preparing their future is equally essential. And that is why skills-based empowerment reached a new level this year. Under the Human Capital Development Project, 1,600 young women and men, supported by 100 dedicated coaches, were trained in innovative entrepreneurship without external capital. Beyond business, this pathway integrates a crucial human dimension where each future entrepreneur is sensitized to sexual and reproductive health, HIV prevention, social cohesion, and the fight against gender-based violence. The results are already visible. Nearly 50% of these young people have launched their own activities. In addition, 32 entrepreneurs from the Orange Corner Accelerator adopted this holistic approach, combining economic success with strong human values including family life planning, health and well-being, sexual health, and gender-based violence prevention. Because no one should be left behind, a pathway to the future was open for 107 out-of-school youth. Through vocational training in mechanics, culinary arts, tailoring, and IT, They now have a genuine second chance. To date, 57 of them are already completing their training, ready to enter the labor market. Beyond technical learning, youth development also involved voice and creativity. In Bujumbura, innovation took an artistic form. In 2025, 41 young artists participated in creative competitions focused on UNFPA's key themes, transforming art into a powerful driver of social change. This dynamic extends beyond the capital to areas where needs are greatest. In humanitarian settings, UNFPA and its partners expanded recreational approaches to break silence and stigma. Through interactive theater in Musenyi and programs targeting key population, activities combined awareness and entertainment, strengthening both social cohesion and the resilience of youth. In 2025, Burundi reached a historic milestone with the release of the first results of the general census. What once took years was completed in under 90 days. Through innovative digital tools, this fully digital census positions Burundi as a regional leader in efficiency and technological modernization. Beyond technical achievement, 18 thematic analysis plans and indicator matrices were validated to transform data into actionable development levers. These data enable highly precise national planning and ensure that resources under the National Development Plan are directed where they are most needed. While our actions transform lives across Burundi, our voice now resonates globally. In 2025, advocacy took on a strategic dimension, positioning Burundi as a key actor on the international stage. At the 69th Commission on the Status of Women and 58th Commission on Population and Development, the government made historic commitments. Burundi also demonstrated regional leadership within the East Africa community, including the election to the Vice Secretariat of the Civil Society Forum and contribution to the adoption of regional legislation against female genital mutilation. These advocacy efforts are not symbolic. They form the political foundation that safeguards achievements and ensures sustainability. The achievements of 2025 are not the work of a single organization, but the result of exemplary solidarity. UNFPA's success is rooted in the strategic leadership of the Government of Burundi, the trust of technical partners, and the financial support of donors, alongside the dedication of the civil society. However, the mission continues. The challenges ahead call for an even greater commitment. In 2026, we reaffirm our determination to transform every gain into lasting impact, ensuring that no young person, woman, or family in Burundi is left behind. Together, let us continue building the future.